Thank you so much for joining today. And today's webinar we are going to talk about is how you are going to prepare for the MRCPCH FOP and TAS. Even though we have already done one webinar about last back, and the recording is already available on the YouTube, but still there are going to be some changes in your exam. So that's why we have to change some strategies also accordingly. As you all know that from the from that is done on and what you are going to expect in your next. So let's just start with it, that how you are going to prepare for this your exam. Voice is breaking. Why is that so? I'm really sorry. I think my connection got this internet connection was not stable at the moment. That's why I have to log in again. So let's welcome back again to another session, that is the webinar and how to prepare for the MRCPCH FOP and TAS. I think all of you are new and you have recently joined our groups. I think so. So that's why a lot of queries were arising in the group that how we are going to prepare for the MRCPCH FOP and TAS and which books to study. And some of the students were even, they don't know anything about that. So we just then planned a webinar for that. So let's just start with it. And you already know that what is your MRCPCH. You know that it is a membership of the Royal College of Pediatrics and the Childhood, and it is a very prestigious, you can say, the degree. And after you are done with whole your MRCPCH with all the parts, you are going to get your GMC registration. It's just like your native country registration. Like you have done the MBBS in whatever country you are, and then you have a medical council or the body in your country with which you become registered. Similarly, in the UK, this is your GMC registration. And for that, you have to pass this, either you have to pass the CLAB or you have to pass this MRCPCH to get that registration, which means after getting that registration, you will be able to legally practice or legally do whatever as a doctor in that country, which means in the UK. And it is an internationally recognized qualification. Like it is recognized in your in UK, as well as it is also recognized in your UAE, and it pay also very good. You can say it pays you out very good in the UAE. Also, if you have like other experience about after MRCPCH, 2 years experience, you can even go to the Australia and some New Zealand and the other countries also. So there are many ways with MRCPCH. So that's why it is a very prestigious degree. And how we are going to achieve our MRCPCH. It has basically the 3 to 4 parts. One is basically 3 theory exams and the 1 clinical exam. The theory exams are FOP, and which is foundation of your practice, and the theory and the science, which is called as the TAS, and your applied knowledge in the practice, that is your AKP, and then you have the clinical exam. Let's move. Today, we are only going to talk about our FOP and TAS because that is what we are going to achieve in our today's session. Because we have other sessions with the AKP something different and the clinical is something different, and the FOP and TAS is totally different from those parts. So that's why today we are only going to talk about this FOP and TAS. So basically, it is called as the part one, which has the two papers. One is your foundation of practice, and the other is theory and the science. And the both papers you have to pass separately. It's not like that you're going to attempt them together in one day, and both of them are going to be together. You have to pass. No, you have to pass FOP separately, then you have to pass the task separately. So it is possible that if you attempt both together in one day, you may pass the foundation of practice, but you fail the theory and science, then you have to reattempt this task again. So be very clear about that, because in the AKP, you also have the two papers, but you have to pass them together. But it is different for your FOP and TAS. FOP and TAS, you have to pass it separately. So let's just see what is the basic difference between these two and how we are going to achieve our these TAS and the FOP papers. So TAS, theory and the science, as it's you can say the name is telling you, it's all about the theoretical and the science, which are the basic sciences. Just like in your medical, if your school, if you remember that you have studied your basic medical sciences in the initial years of your medical school, like your anatomy, your physiology, some biochemistry, pathology, that may be journal and the special pathology, and then you have like embryology and some other basic sciences. So this is all about your task. Why they have, you can say, why they have incorporated this basic sciences or the basic theory in your MRCPCH, because they are going to prepare you from the scratch. None of us, I don't think so, know much about the anatomy. We don't remember. Maybe little bit we remember the anatomy and the physiology and some pathology, but with very clear concepts we don't remember up till now. Like in our, it's been like years to, from our med school, we have graduated. So that's why they are going to prepare you. Basically, if you go into the core of the MRCPCH, you, it is a very beautifully, they have you can say constitute this exam, starting from your task, theory and science basics. Then they jump out to the foundation of the practice, which is a little bit clinical knowledge and some nice guidelines. Then they jump out to the AKP, that is also clinical regarding the management point of view. And then they jump out to the clinical along all the other things which finally you need to be as a registrar in the UK. They just have incorporated in your clinical. So this is a very beautifully designed exam. If you just understand the core of this exam, then it will be very easy for you to go through the exam. The reason why the students fail is that they just jump out to the books and they don't understand that what is this task about, what is this FOP about. So they just start like from A to Z, start to read the books, whatever they listen, or maybe they read like in different groups that this is the book you have to read for it. So they don't know what is the core knowledge you need for the task and the core knowledge you need for the FOP. You need to focus on those topics, on those core knowledge, and then you have to do the target study, and only then you are going to able to pass in your exams. So your task is basically, it assesses your basic scientific, physiological, pharmacological principles of the clinical practice. So starting from your anatomy, is going to make like about 5 to 6% of your task exam. Then afterwards is the physiology. Physiology may be going to make about like 25 to 30%, and the pathology along with that. Then we have some not some, but much pharmacology. About like you can say 15 to 20 questions you will get from the pharmacology in your task exam. So you see, it is making a huge portion. And if you just start reading from the A to Z, a book like SOP, which is recommended for the task, and you don't know that which part or the which thing or the which topic is going to make the bulk of my task exam, that is your pharmacology. And if you are not going to enough concentrate on the pharmacology, then you are going to miss those 15 to 20 questions, and that is going to make the downfall for you in the exam. So you need to focus on what is it all about, whether it's task or whether it's your FOP. So there's going to be the anatomy, there's going to be the physiology, then there's going to be the pathophysiology, very importantly pharmacology, like mechanism of action of the drugs, their side effects, their interaction with the other drugs, and something like that. Then we have the stats. Stats is also very important. You will get about like 4 to 5 questions from the basic statistics in your task exam. So these are all the basic things you can say, which are they are going to ask you in the task, and you have to focus on that. You have to focus on physiology, pathophysiology, embryological defects, then like your basics like your ABG interpretations, your pulmonary function test interpretation, your ECG basics of your ECG, like what is the P denoting a wave in your, like suppose this is your ECG, then what is denoting this P wave, what is denoting this QRS, and what is denoting this T. So all of these are the basics if you just concentrate on that. So you need to prepare it accordingly. If you think that I have done the FCPS pediatrics and I can easily go through this exam, I don't need to read anything and I will just do the recalls and then it will be all done for me. No, this is not the thing. If you don't focus on the task, if you don't focus on the core topics which they are asking, they are going to ask you, then how you are going to pass that. As a FCPS pediatrics, I know that I have done the FCPS. We don't know. I know we don't know much side effects. We don't know much pharmacology. We don't know much statistics. We don't know that deep embryology or the anatomy because we are all focusing on our clinical practice. So that's why it is very important. Then there will be 100 questions in your and that were all best of 5, which means they will give you a scenario about like 3 to 4 lines, and then they will give you 5 options, and among that you have to choose the best of the 5 those options. They can ask you what is the best investigation, or what is the best next step, or what is the best initial management, something like that. So you have to choose accordingly. Previously there were like about 80 questions of best of 5, and about like 10 to 15 questions were from your extended matching questions, but they are now being obsolete. They have just removed them from the your paper. So that's why you are now going to focus only on your best of 5 questions. And the time has been now 2 hours. Previously it was 2.5 hours, but now it has become, they have just reduced it to the 2 hours. So this time in the 16th of October, it was very difficult for the students to complete the exam in the 2 hours. Some students may have that just because of that. So you need to be very particular about your time management. Then TAS is always, no, sorry, this is TAS is always in the afternoon, and your FOP is always in your morning. So this is all about your task, and this paper will be always in the afternoon around Pakistan time. If we talk about it, it will be around 3 p.m. And what is all about your foundation of the practice? This is more a bit about your clinical knowledge. So it is going to assess a candidate's knowledge and the understanding and the clinical decision-making abilities. Like they are going to tell you that they are going to know, they will give you sign and symptoms, and then they will ask you what is the basically diagnosis, and then on the basis of those sign and symptoms you are going to make a diagnosis. What is the diagnosis there? Then afterwards they can also ask you that what is the next best investigation, or what is the best next initial step. This is how they are going to ask you in your FOP. That will be clinical, your clinical knowledge, that are you able to make a diagnosis when a patient presents in the ER or in your OPD or in your clinic. That is what they are, after preparing you from the basics, now they are moving on to your clinical knowledge. So they are telling you, they are asking you that what is okay, I think I am having some questions in my chat box. Okay, I will, you can just drop your all the questions in the chat box, and once I am done with this webinar, like all the like 10 to 15 slides are only there. Once I am done with telling you how you are going to prepare, then at the end I will answer all of your questions. Okay, at any point if you have any question, just drop it in your in the chat box, and then I will just answer those questions at the end of this webinar. Okay, so the foundation of the practice is just about your this is clinical knowledge, and about clinical knowledge and how you are going to incorporate whatever the guidelines UK has developed for their country, and that are called as the NICE guidelines. And these are both pediatrics guideline are different, and your neonatal guideline are the different. So how you are going to make a diagnosis on the basis of those guidelines, NICE UK guidelines, how you are going to make a diagnosis, and how you are going to order the initial investigation or the confirmatory investigations, and how you are going to manage that patient. That will be going to be your FOP examination. It is also going to have the 100 questions, best of 5, and the time is again for the 2 hours for your FOP also. And it is always in the morning. This is the morning paper, and the TAS is the afternoon paper. And the thing is that the most important question that people ask that can we attempt them together or can we attempt them separately? It's all your choice. It is possible that to attempt them separately, and it is also possible to attempt them in the one a day. If you book you both of your exams in, like, if suppose next exam is in the February and you book both of your FOP and the TAS, then you will get on that day, that exam day, you will do or you will take your FOP examination in the morning and your TAS examination in the afternoon. But if you book only one exam, suppose if you book FOP or if you just book the TAS, then you will take your exam regarding like FOP will be in the morning and the TAS will be in the afternoon, depending upon whatever you have the book. So you can attempt them together and you can attempt them separately. But the thing is that I prefer and I recommend that you do attempt them together, because almost this syllabus, whatever they have given, it is overlapping. So when you are preparing for the task, many topics you are preparing for the FOP also. And when you are preparing for the FOP, there were many things which you are preparing for the task also in the FOP paper. So that's why they are overlapping so that's why I recommend that it's better to attempt them together, and they need to pass separately both. You need to pass TAS separately and you need to pass TAS FOP. But even if you attempt together and if you failed one, then only you have to attempt that which one you have failed. Suppose if you failed FOP, then only you will appear again in the FOP, not the TAS, because TAS you have already passed that. So you need to pass only or read only that this paper which you have failed that. Okay. Okay, BOF is basically best of 5 questions. I already explained that you will get a stem of about 3 to 4 like scenario of the lines, 3 to 4 lines. Then you will get 5 options, option A, B, and the C, and the D, and the E. This is called as the best of 5. Among those 5 options, you have to choose what is the best in this scenario, or in this, whether it's diagnosis, whether it's your investigation, it's your management. Okay. So how we are going to do, or how we are going to achieve our goal, how you are going to study. Remember that there is no substitute for the hard work. I have been in we are going to have our 4th batch of this FOP and TAS starting from 21st from 18th to from today tomorrow onwards. So I have seen many intelligent students and I have seen many dull students. So the thing is that if you are going to do hard work, no matter how dull you are going to achieve it. No matter how much intelligent you are, no matter how privileged you are, no matter how much knowledge you already have, no matter how many degrees you already have, if you don't do the hard work, if you don't put your energies in this in this exam or whatever you are going to plan, whether it's FOP, TAS, it's your AKB or your clinical, you are not going to achieve that, because you are not putting your hard work in that. Because every exam is different. You cannot pass with, if you have the FCPS, you cannot pass this MRCPCH on the basis of that. It's a totally blunder to just underestimate this exam. So that's why hard work is compulsory. Just if you are in this think in this exam, in this pathway, then the hard work is your first thing which you need to have. If you don't have that, then I'm sorry to say that it is very, very impossible that you are going to achieve this. Now, what are the study materials which you, with the most important questions which they are going to usually students ask that what are the study material? If we talk about the task, then it is all about the basics which we talked about, and the recommended book is that Science of Pediatrics, which is called as the SOP book. Along with that is the clinical cases book of the TAS. These 2 books are the compulsory and the compulsory, and both of these books are given by the RCPCH. These are their books and they have recommended that, and believe me, every question in your exam, you will find the answer in your book, that is the Science of Pediatrics. Everything they have given in this book, even it is a very, very long book. It at least takes 6 to 8 months to completely cover, but it is not possible to cover at the moment, you can say, or in just 2 to 3 months. So you can do the selective topics which are very important and have been repeatedly they have asked in your exam. But this book is must and the must, along with clinical cases of the TAS. This is also must. But yeah, along with that, you will go for the past recalls. At least for the last 5 years recalls, you need to attempt, you need to do that. Then if we move on to the FOP, the most important thing for the FOP are your nice pediatric and the neonatal guidelines. You cannot pass this exam without doing these guidelines. So because this exam is all about your guidelines regarding any topic, whether it's otitis media, whether it's pneumonia, whether it's your congenital heart disease, whether it's your neurology, endocrinology, everything they just ask, it is about these guidelines. Then it is very important to attempt these clinical cases of the FOP. Illustrated textbook of the pediatrics is optional. If you have enough pediatric knowledge background and the pediatric background, then you can skip that, because this is for the just basic knowledge for making a diagnosis, having sign and symptoms and all about that. So you can go through if you have the time, but if you don't have the time, then you can just concentrate on both of these, clinical cases book and the pediatric and the neonatal guidelines. Then along with that is the recalls, past recalls, obviously. One thing I want to mention is that these books, clinical cases book are and the illustrated textbook of the pediatrics, these are quite, you can say, the old books. With the passage of the time, we have the changings in our guidelines. So it is like, I will just give one example, like asthma guidelines. Asthma guidelines, whatever they have given in your clinical cases of the form book and your illustrated textbook of the pediatrics, they are past guidelines. They are not nowadays not being used. So whenever you read a topic from your like a clinical cases book or from your illustrated textbook of the pediatrics, just go through the recent nice guidelines, but whether it's pediatric or the neonatal, that if are there any changes been there, like as in the asthma, all the changes have been done, and whatever given in your clinical cases and the illustrated, these are past guidelines and they are now a day not being used. So that's why always go for the recent guidelines. Always check your recent guidelines. And we have provided the drive in our a Google Drive in our groups, in which we have given all of these nice pediatric and the neonatal guidelines, which are all 2022 to 2024. So these are all recent guidelines. You can go through that. So these are the study material which you need to that. Another important question which they ask you, whether we need to go for the past test subscription. You don't need to do that. Previously, I recommended it now, but after seeing the students getting confused with these past tests, because many questions here also have the previous guidelines. So they get confused that you are saying that this is the answer, but past tests say this is the one. Because they don't like to believe on in me or my other colleague who is also the mentor, Dr. Zabira. Whenever they ask some question, they like to follow this clinical cases book, this illustrated textbook, and the past test, because this is a subscription from the UK. But the thing is that even though I provide them with the evidence from the recent guidelines, they don't like to believe that. So they get confused. Don't do that. Don't show that arrogance. I will again say, you don't need to do have any subscription of any other MCQ pool. You just need to concentrate on your past recalls after you are done with all of these studying. And the past recalls, you are not going to ratify it. Just remember that. Don't ratify them. This is what happened in recently in this October batch and October students. The students who just ratified the past recalls, they have very difficulty in attempting this task, especially task examination. But even though task was, when I am the paper is now available and I have gone through this task, and it is all about your past recalls, about, like, you can say 75% paper is from your past recalls. And the student said it was very difficult, and I was very afraid that what they have added new into that. But the thing is that they just ratified the questions, these past recalls, and when they just went to the exam, and even though they give you the past records, but they twist stems, they twist your options, like they twist any like one or two sign and symptom in your scenario, and then in the option they just totally change the option, or maybe one or two options are the from the past records and 3 to 4 options are the new. So the students get confused that it was not in the past records, now what we are going to do. The thing is that if you have gone through the topic, if you have the grip on the topic, then it is basically no way that you cannot solve that question. So that's why past records didn't meant that you have to just ratify them, you have to ratify the answer. This is, you are not going to go anywhere with these ratification. Remember that. Even you can ask them which have just attempted the October exam, you can even you can ask them one by one, any student you can ask them, and they will say that you need to be have very good grip on your concepts and the topics. So that's why never do that. I will again recommend that never do that. First you have to study what you need, what about all the topics, about all the guidelines, and then you can attempt your recalls. So how to study, what is the next step? I will just advise you that just take one paper, one FOP and the one TAS paper, whatever you are going to start, whether it's FOP for the or the TAS. Suppose you are going to attempt the TAS, you are planning for the TAS examination only, so a paper. So just have one paper, maybe it's like from 2021, like October 2021. Just take that paper and try to solve it. And then see that where you are standing. It will tell you where you are standing. Are you able to solve that paper 50%, 25%, 20%, 10%? Are those topics which they have asked in your that paper, you are familiar to them or not? You have knowledge about them or not, you have concept about them or not? You will know that where you are standing. You will know that whether you only need 2 to 3 months of the study, or you need about like 5 to 6 months of the study. It will tell you all about. I cannot tell you, no one is going to tell you that how many months or the time duration is required for you to prepare. It's only going to be determined by yourself. And how you can do that? Just take one paper of the task, the for whatever you are aiming, and just try to solve that, and then see where you are standing. Are you even able to like solve about like 10 questions, 20 questions, 5 questions, how many? And you will know that how much hard work you need, how much time you need for this preparation. It will also tell you what is the exam pattern, how they are going to ask you exam, like if it is ABG interpretations, if it is anatomy, if it is physiology, like regarding a specific topic, then what are they are emphasizing on, things are there in that topic they are emphasizing. So this is going to tell you your exam pattern. Then it will also tell you the types of the questions which you're going to have, like whether they like to talk about investigations, management, or your physiology, pathophysiology, pharmacology, their side effects, mechanism of action, like what type of the question they are asking. Then the depth of the knowledge required. Some topics are there which you need to be in your brain all the time. You have to memorize them. You have to make a very good grip on them. But there will be some topics, some like areas which you don't need that much depth of required. You only need to be superficial, and you just have to be concept about that, and then you can go through just bypass them. But some topics need very deep you can say the concepts and the clearance regarding that topic. So it will tell you, it will give you an idea about that. Assessment of the strengths and weakness, obviously you will know that if suppose you like the neurology, it is possible that you are able to solve the neurology questions, and but you are deficient in your cardiology. So you will know that you have to be focused, you have to spend more time on the cardiology as compared to your neurology. Then key areas of the focus, which some of topics are there which are being repeated and repeated, and they are compulsory in every exam. They always give you those questions from those topics. So you will be able to know what are the key areas of the focus by the RCPCH, or what are the favorite hard topics of the RCPCH. Then it will also tell you you need some guidance or not. You can prepare it on by your own self, or you need some study partner, or you need to join some other forum to prepare by yourself, or by the mentors, or by taking the lectures, or by having like any type of the guidance. You will be able to know that. And for all that, what you need for the preparation, as I told you just in a few minutes ago, that the hard work and the determination is the key. Hard work is the key. Hard work is the key. Without hard work, it is possible that you get like through the exam just by doing the recalls. But once you are in the UK, after completing your MRCPCH, I cannot guarantee you that you will be able to work there. You will get frustrated there because you will not be familiarized with their system. Because this exam is all about familiarizing with their guidelines and with their system and what things are important regarding the UK medical, you can say the field. So it will prepare you. Basically, this exam is not just to pass, it is preparing you for your next, you can say the journey in the UK as a pediatric registrar in their hospitals. So that's why it is very important to do the hard work with determination to know the essence of these exams and prepare them accordingly. Then guidance and the understanding of the exam. I talked about understanding, which I have given you a bit about that. And if you still need that, you can always welcome to ask us in the groups or anywhere in this webinar. I will obviously, there are a lot of queries in the chat box and I will answer at the end of the this webinar. Then the planning ahead. You have to plan accordingly, whether you are aiming for the 3 to 4 months preparation or whether you are aiming for the 5 to 6 months preparation. You have to plan accordingly at least 1 month before exam. You have to complete your preparation, and the last month is just for the revision. I know that most of you are doing the jobs or in the trainings and doing the clinic, so you are all busy. So you have to take the time out of your clinical busy like routine, and you have to give at least like about 4 to 5 hours. If you have very good pediatric knowledge, background knowledge, then at least 4 to 5 hours daily to this exam. And if you don't have that much pediatric background, then at least 8 to 9 hours daily. Then focus with the targeted study. As I talked about, some areas are there for which you need deep and the core knowledge, and some are there you just need the superficial knowledge. So you need to be targeted, because it is not the like this time is not like you just sit down and you start this book from A to Z, and at the end of this reading this book, you are not able to remember any one single thing. This is not the way nowadays the study is done. Study is nowadays is a targeted selected system, like cardiology or the neurology, whatever you want. Then choose the topics which are very important. You have to spend so much time, and that may be like about 8 to 9 topics or 8 to 10 topics. Separate them, focus them, do them very hardly and spend much time on them. And then there will be about like 7 to 8 topics which you just need to go through them. So this is how you do the targeted study. Then attitude change. This is a very important. Whenever you enter in the MRCPCH world and you want to attempt this exam, just remember that this is a new world. You are in India, you are in Bangladesh, you are in UAE, you are in Pakistan, or you are in like Dubai, or you are in anywhere, UK, or maybe in Nigeria, Somalia, Africa, wherever you are. I will just say that whenever you enter in this MRCPCH world, just enter with this mind that you are going to learn something new. I know that all of you at this point, some of you are just beginners, like they have just done the graduation and the house job, and then they are just entering into it. But most of you are those who had already done the like FCPS, MD, and some other like degrees in the pediatrics. So I have seen this mindset in the last like few months that when we are done with this FCPS or the MD or some other pediatric degree, then we think that we know each and everything. This is not the way. This is not the thing in MRCPCH. You will know that just enter whatever you have done, leave it behind, and enter with a new mindset that you are going to learn something new in this exam. And believe me, you will be shocked and you will be surprised every day. Like about I can say that 75% things are going to be turned around. when you are going to read these guidelines which UK have devised for that. So that's why this attitude is very important. If you are arrogant, you are not able to accept that I have studied this my whole life, I have done this clinical practice my whole life, how it can be changed, how you can say that this is not the answer, then I will just advise that go through the UK guidelines, and then you will be able to know that what are they practicing in their world. So we just have to enter in their world, and we have to leave our world behind. This is what I just will request all of you. Then revision technique, how you are going to revise, you at least need 1 month before exam for the revision. Time management, specifically if you are not able to cover your syllabus till the end of the exam, 1 or 2 days before exam, then how you're going to revise and how you're going to attempt your exam. It will just make you burdenize you, and you will get panic attacks that I have not revised not a single thing, how I am going to attempt my exam. So time management is very, very important. Then you need to be confident. Whatever you have read, be confident that this is the one and this is the answer there. I have read about, I have the concept about it. And the personal support, then it is very, very important, whether it is coming from some mentor, whether it's coming from some your teacher, from your senior, from someone who has already passed the exam, from your family, from anywhere, whoever you have in your close circle. Personal support is very important, because there will be many ups and downs in this journey, like in that 3 to 4 months or the 5 to 6 months preparation, that there will be many ups and downs. So you need someone to be there for your personal support, and specifically before exam when you get panic attacks. So it is very important that you need to be, someone need to be there, and who is going to support you at that moment, and giving and who is going to give you confidence, and that is all you need at that moment. So I am clueless what to do. Even after I have told them each and everything, even in the personal WhatsApp messages, they ask me repeatedly, I have this background and how I'm going to prepare. Then what? And still they are clueless, and they don't know from where to start and how to start and how to manage the time, how to make a plan, study plan, then what to do. So one solution I have, that I am already available, and my other colleague, that is Dr. Jabira, is also already, like, we are almost, you can say, 24/7 available. Also, our team is also available in the WhatsApp group. Whenever someone text in the group, or just ping me in my personal WhatsApp, I always there to support them, to guide them. But still, if you are clueless, then it is an opportunity that you can opt for your personal tutoring. And that is what our course, which this is going to be our fourth batch, and up till fourth batch, not a single student has ever failed this exam. We can provide you the evidence, we can give you the evidence, we can share the feedbacks, not a single student. So this is and if yeah, not a single student. So this is all I can tell you. And as I have devised this course, so I can you can say 100% with a surety that it contains all of the things which I have just told you, because we are going to cover in all the lectures. We have covered SOP, all the topics. Like if it is a cardiology, then everything related to cardiology, anatomy, physiology, embryology, pathology, it has been incorporated from your SOP book into the lecture. Then from the illustrated textbook of the pediatrics, clinical cases of the FOP and TAS, NICE pediatric and the neonatal guidelines, whatever guideline is recommended or is necessary for the exam, that has been incorporated in it. Then after giving all of these lectures, these and the PDFs are available, sessions are available, you can join the live session, or you can read, or you can just listen to them, watch them according to your feasibility. After we have done these PDFs, these lectures, then we are going to see this last 5 years recall sessions. PDFs are also available, and the recalls video sessions are also available. Suppose our first lecture is about the cardiology, we have the 2 lectures. After we are covering all of these things in our lectures, whether it's NICE guidelines, clinical cases, illustrated textbook, and the SOP, then this is the thing you can also follow. This is I'm telling you just so that I will give you an idea that how you can start with all of these. Either you can just join us, or you can do it on your own self. But this is how you will do that. You will do SOP illustrated clinical cases and the pediatric guidelines. Suppose just have a topic that is cardiology system, and you will do all of those things from these books. After you are done with the cardiology, then you will go for the past recalls of the cardiology system only, and you will try to solve them, these recalls topic wise, only FOP and the TAS about cardiology, not the whole papers. Then this will only, you can say, the emphasize or reinforce your whatever you have studied in your books and the guidelines and all these things. Then after done with the recall session, then you need to do a mock exam. This is what we are doing basically. After these lectures, like suppose we cardiology started, 2 lectures are done, then the students will have this video recalls session, in which last 5 years recall of the cardiology has been incorporated. You will get both PDF as well as the video session. And then after that, after you are done with this video session, and then you will get a system-wise mock. Then you will get the cardiology mock system at the website. You will attempt that, and it will tell you that how much things you have learned, and have you covered, and have you that much grip on the cardiology or not, with the result of this mock. And after this is how we are covering system wise, like cardiology, respiratory, and your neurology, everything. First is your books, then you have the recalls, then you have the system wise mock, and at the end of the total, like all the lectures and all the systems, then we have a grand mock, as well as the personal support and the guidance tailored to one's need. It is possible that I have one student who is FCPS, but the second student who has just done his house job. So they both are not at the same levels. They both need different types of the support. So I have to support my having FCPS pediatrics who already have much knowledge, as well as I also have to support the newbie who has just done the house job, who has just done the graduation. So I have to be at their level to support them, to guide them regarding the preparation. So this is how like everything is tailored according to your knowledge and your background knowledge, and at what stage you are just you can say falling or standing. So this is just an example. You can just make a timetable accordingly, just like that we have done that. You see, starting from the cardiology, this is the session 1, part 1, and this is the session part 2. So after we have done both of these, you see it is on 23rd October and this is 25th of October. So we have, like, in between we have the gap, so that you can go through by yourself also after attending your live session. So you will prepare all this theory in these 2 lectures, and after that you will listen to this cardiology recall session. Both for the FOP and the TAS are separate. You will be provided with these recall session. And after you have done last 5 years cardiology recalls, then you will attempt this mock test of the cardiology on the website, so that this is also visible to you, and this is also visible to me also, and our other team also. So we will monitor your progress also, that where you are standing. And if we see that at some point you are lacking and you need further assistance, then we can make a proper plan, like how we are going to target it. You may need to do revise further. So we will provide that much time during that session, or in between the lectures. Similarly, this is the neurology part 1, part 2, and then is the neurology recall sessions. You will do that, and after that you will attempt the neurology mock test. So this is how you are going to do that, and this is what it is all about. Again, the live sessions, then subject-wise recalls. It is very important to do, because if you just sit down and start to attempt the whole paper at one go, you will not be able to do, and you will just panic, because you have not prepared all the systems, and you will just panic out. And the recordings and the PDFs is available, subject-wise, then mock test is available, 24/7 WhatsApp group, and the grand mock at the end, and even though exam booking support whenever it is going to be the exam opening, booking window opening, and our team is 24/7, and we have like booked the exam about for about hundreds of the students by ourselves. Even we have sometimes paid by by our team, and then the student paid us afterwards when while booking the exam, because their credit card or a debit card declined at that moment, and they were not able to book the exam. So we just did that. So the thing is that I just want to say that our team is available 24/7 for your support, and it's been in the last year for you. It's the 4th batch, and up till now Alhamdulillah, not a single student has even failed this exam, whether it's a free group activities or whether it's a paid course. So this is how we are going to do all of these. And let's now, I think that's all. And now I'm just going to read your questions and I'm going to answer that. And I hope so most of the questions I have answered in my this session, but let's just see. Is there any negative marking? Dr. Abhilash is asking Chatterjee. No, there is no negative marking. And Dr. Dell, okay, Dell is asking if someone giving both TAS and the FOP in first diet and if fail in one, should be repeat both. No, I have told this about. The one which has you have failed, only you have to appear in that exam. Okay, you don't need to appear both of the exams again. If you have passed the TAS and you have failed the FOP, then you only need to reappear in your FOP examination. Dr. Halima is asking what is the passing marks. Dr. Halima, it is different every time because it is a percentile and they have different set of, you can say, marking these questions depending upon their difficulty and how many students have attempted that question wrong. And it is possible a very easy question and like about 70% students have marked that wrong. So they will just omit that question from their marking. So it is very different and we cannot predict that what will be the percentage, but usually it is between 60 to 70%. Last time TAS was about like 59.94% and I don't remember about the FOB. So it is different every time. There is not a set criteria. Dr. Afreen is asking any negative marking? No. Dr. Dania Abbas, okay. Yes. Okay, Dr. Afreen, for someone who has not read the books for some times, but doing MOship in pediatrics for a long time, what should be attempted first, TAS or FOP or the both? Dr. Afreen, as I already recommended that, I will suggest that you take about like 1 to 2 months more, but try to attempt both together because almost you need to, these are interchanging things. You can say that if you are reading about the cardiology, suppose, and you are talking about, you are reading about the like VST pathophysiology in your TAS examination, then you have to read that again in your FOB because you need to know the pathophysiology for the VST, clinical sign and symptoms, and to make a diagnosis. So these are the almost the same things, you can say. They are overlapping things. So whatever you need to read for the TAS, you need to again read it for the FOB. So I always recommend that don't rush it out. And if you have time or if you can give 1 to 2 months more to the preparation, then please attempt it together. Otherwise, you can do it on your own behalf because TOS is all about basics. So sometimes students find it more difficult as compared to the FOP. So if you are in the pediatrics for a long time doing MOship, which means it is a clinical thing, so you can attempt the FOP before the TOS. Okay, can you elaborate on 100? Okay, this is best of 5 questions, basically BOF. Can you elaborate topics of the FOP as you did for the task, like percentage wise? Dr. Afreen, we have if you go on the RCPCH website, then they have this syllabus division regarding TAS as well as FOP from the different systems. So I will ask my moderator, they will upload it in the group also, and you can go through that syllabus, like how much they have percentage division from the every system. But the thing is that they rarely follow that division. So it is all, every time it is different. Only TAS is the one which is consistent, is the pharmacology, which is going to be like a highlight of the TAS. But for the FOP, every system you can say about going to have the almost equal questions, not something like that who is going to have the 10 to 15 questions. It is not like in the FOP. In FOP, almost every system is going to have about 6 to 7 questions. Dr. Shweta is asking, is FRCPCH different from the MRCPCH? Can you please elaborate between these two? Yes, FRCPCH is different because you cannot get FRCPCH before MRCPCH. So if you are done MRCPCH and you are practicing in the UK, and may you get into this specialty training in the pediatrics there, and or maybe you have become like after MRCPCH, you are doing the job there, then with the passage of the time, there is set years of the clinical experience in the UK when you have that along with different other set criterias. Then when you are going to fulfill while you are doing the job in the UK, then you will be able to apply for the FRCPCH in from the Royal College of Pediatrics and the Child Health. So it is different. It is in the long run, you can say that. The initial step is the MRCPCH, or you just have to enter the your UK system. You have to start the clinical practice there, and with the passage of the time, then you can go through different things, different researches, different clinical experiences, and the other things then which are going to make you eligible for the FRCPCH. From where to buy SOP and clinical cases books. These are books basically are available in the PDF forms in our group and also in different groups. You can go and to any bookshop and you can just give them the PDF and they can just print that out, because they are not available as such in the Pakistan. If I talk about the Pakistan, then they are not available there. And but some bookshops in the Lahore, as I just know about the Lahore, then in the Jinnah bookshop, if you are from anyone in Lama Iqbal Medical College, there is the bookshop which is available, and in the Gangaram bookshop, which is along with the Fatma Jinnah Medical College. So there are different bookshop in every medical college, or even without that, you just go to a bookshop or some printer and you can just print it out. Already subscribed to the 4th-month course from the MedPrep Online. Kindly recommend the study pattern. What study should I do before listening to your lecture? Thank you. People have recommended BMJ examination for the questions. How good is that question bank? No, BMJ is not at all for the MRCPCH, because that is only your one-line questions and your true and false questions that has been obsolete a long time ago. So it is not at all recommended nowadays. And Dr. Malik, you have already subscribed to this course and you have already scheduled that first lecture is going to be on the cardiology. So usually the first lecture is regarding our basics regarding our TAS examination. So you can go through the SOP book, cardiology system, along with the clinical cases of the cardiology from the TAS. And once this is for the first session of the cardiology. And when we will have the second session of the cardiology, then you can go through the illustrated textbook of the pediatrics and the FOP clinical cases cardiology only. There is also a table in which we have categorized that 2, 3, 4 clinical cases are for the cardiology from the FOP, and similarly 3 5, 6, 7 are for the respiratory. Accordingly, we have divided them. So we will give you also that table, so you can go through by the system wise from those clinical cases book also. And this is how we are going to do. And let's meet in the course also. Okay. Okay. Passing marks, I have again told you, Dr. Afreen Humayun, there is no set criteria for the passing. 60 to 70% is in between, anywhere it can fall. For the whole MRCPCH, how many years of pediatric experience do we need, Dr. Yasir? You don't need any pediatric experience for any part of the your MRCPCH, whether it's FOP, TAS, AKP, or even the clinical. You don't need any clinical experience to apply for the exam and to sit in the exam. They recommend that you should have 2 years experience in the pediatrics, so that you have a very ground of the pediatric knowledge and the clinical knowledge, so that it will become easy for you to attempt the clinical your exam. But you don't need any experience. With zero pediatric experience, and when you apply for the clinical or whether any part, they don't ask for any experience to upload on when you are going to apply for that exam. So you don't need any experience. When should one attempt this paper? Like minimum how much of the experience is required? If someone is only PG1 with 4 months experience only, should he go for that? Okay. If you are PG1, I will recommend that you should go for the TAS only examination to make your basics strong. So because it's only 4 months experience, you don't know much about the pediatrics up till now. And for that, you have to work very hard, at least 8 to 9 hours, at least your study daily for both, attempting both. But at this level, with PG1, with only 4 months experience, you can attempt your TAS examination very easily. So because it involves ABG interpretation, it involves ECG waveform, it involves your pulmonary function test interpretation, it involves your anatomy, it involves your pathophysiology. So once you have this background knowledge, once you are PG1 and you have passed your TAS examination, then within 1 year, you will get your pediatric knowledge also. And after that, you should go for your FOP also along with that. But at this moment, I will recommend that only go for the TAS examination. Pediatric experience of how many years also you don't need any experience for applying any part, whether it's clinical or the theory, for your this MRCPCH. When will be your crash course, Dr. Aisha? Crash course will be in the last month, like in the, you can say January or the February, because it is always in the end, just to give you a comprehensive review. And if you people, because we don't recommend just to go through the recalls. Theory is very, very important. You can go through the theory in the initial 2 to 3 months, and then in the last 1.5 months, you can focus on the recalls along with the revision. So the crash course will be in the last 1.5 months, inshallah. The course will end on 31st January, which will leave us with only 18 days before exam. Will this be enough for revision? Because you suggested that at least 1 month is required for the revision. Yes, Dr. Kosha, because we have already incorporated everything in these lectures, along with already done this recall sessions. Once you are done with all of these recall sessions, you are done with the mock examination, you are done with the grand mock examination, then it's very easy to go through in the last 20 or the 3 or the 2 weeks, to just go through the those recalls, and then it will be all right for you. The thing is that this is for those people who are doing on their own selves, because they're not going to, I know that none of you are going to go through the SOP or the clinical cases books wholeheartedly, or because you have 50 cases in clinical case FOP and you have 50 cases in TAS. It becomes very difficult. Even if you just complete one book, I will be very happy. But the thing is that in lectures, we have incorporated everything, and in a very in a very easy to understand, understandable way. It is not like that we have put from A to Z, every thing, every line in the thing. Only thing that is important for your exam, that is easy to understand, and that is going to give you the concept of those things. So it is very easy to revise those PDFs, because you don't have to hassle go back and forth from one book to another book. So you have all composed and compiled in one PDF. Similarly, you have all 5 years recalls composed and compiled in one PDF and in one recall session. That is only about you can even revise 5 to 6 systems in one day. So it is very easy to revise with all of these things. The thing is that how you are going to revise that. If you're on your own and you have to go through from one book, second book, third book, fourth book, then the recalls, you don't have the system wise, you have to go back and forth from the 21, 22, where was that? And this is hassle. So you have at least 1 month for that. But when you have already all the things compiled in one PDF, you can say, or in one session, then it is very easy to just open it and just go through, and you can easily then revise one system in one day with even recalls. So it is more than enough. What will be included in that? Okay. I have registered with RCPCH for FOP TAS October 24. I didn't book the exam date. Do I need to register again for the FOP TAS Feb 25? No, Dr. Smitha, you don't need that. Okay, there are a lot of questions. Can we apply for the fellowship in UK after completing all parts of the MRCPCH? Yes, Dr. Sapura, you can, because you will get the GMC registration and then you can go through that. Course is starting when? Okay, Dr. Sana has. MRCPI versus MRCPCH, which is better in terms of training there and saturation of the pediatrics. Both have had their own pros and cons, and MRCPCI is for the island, MRCPCH for the UK. So it's all your preference, whether you want to get settled in the island or whether you want to get settled in the UK, because both of these After that, you can enter in their specialty training, whether it's UK or whether it's Ireland. So saturation in pediatrics, there is no saturation. Still a lot and a lot of posts are there which are empty in the pediatrics, and this is the least, you can say, uh, competitive field in the UK. So most of the seats are always there, are hundreds of the still there. But the thing is that only the junior level posts are after PLAB, if you go, that are saturated. But after MRCPCH, you have many options. So don't worry about this saturation. It is available at Winco Medical Shop at Do, Karachi. Yes, it must be available there. You can ask that. Also available on the Nishtar books. From where to buy SOP and clinical cases books? Yes, I have already talked about that, where you can buy any medical college bookshop. You can go there and you can ask for these books. They will print it out and they will give you. Do we need to read survival guide for FOP and TAS? No, you don't need to read for that because it is a bit oriented for your clinical type for your AKP. So you can get basic knowledge, I can say that, but it is not necessary to go through for the FOP and TAS. I am in pediatric training for 4 months. How much time required for me? I talked about that. If you are doing PG1, and it is better to just go through the for your TAS examination rather for the FOP both together. And it also depends how much time you can give. If you are able to give about like 7 to 8 hours per day daily for at least 4 months, then you can go through both of these exams. What's the fee for the, okay. How much time required for the preparation for the FOP and TAS? I have done my 2 years of the PEDS training. You are good to go as you are eligible for the IMM, and I think you must have prepared for the IMM also. So you need at least like 3 to 4 months. That's enough. With at least 4 to 5 hours study daily, but target oriented study, not A to Z books. Then you will be good to go. 3 to 4 minimum. If we book the exam but not able to give due to medical reasons, can we postpone it? You can postpone it only if the window period is open, like the booking is going on still, only then. But if once the booking has been closed, then you cannot postpone it, and you can apply for the refund, but there is no guarantee that they will refund you. It will all depend. If you have some medical reason, you need to provide them the evidence. Then their committee will decide whether this is a strong evidence, is there reason is there or not. And if they think that this is a strong reason, then may they refund you 50%, may 25%, maybe 100%. It all depends on that. There is no set criteria, but refund is not the guarantee after the window booking has been closed. When booking exam is open, if I will enter the FAB 25. It will be available. It is present on the RCPCH website. We will just post those window bookings, application open and the closing date in our group. Essential books of MRCPCH from MrcpCh was also recommended by some people. Does it contain topics that are high yield from the exam? No, it was previously, but not nowadays, because the exam pattern has been changed. Exam has been changing, so it is obsolete now. And they also don't recommend that. They recommend your SOP book for TAS, and they recommend illustrated book for your FOP. They have not written anywhere this MrcpCh. Okay. Okay. For new doctors, what is your advice? Will it be possible to pass exam in the FAB if we have no previous PEDS knowledge? iPhone, I have already answered this question 2 times, that you can go through the TAS paper only. If you are very desperate to go through the FAB examination, FAB paper, then you can only prepare for your TAS, because that is all about the basics, pharmacology, stats, anatomy, embryology. So it will make a very good basic for your further training also, and for your FOP exam also. Dr. Mia Mohsin, FOP recommended books I have told in this webinar. I will also tell you that illustrated textbook of the pediatrics, clinical cases of the FOP, and the nice pediatric and the bedside guidelines. For how many hours approximate class daily there, man? to know whether to manage along with the job or not. Doctor, okay, it is approximately 3 hours class according to the schedule, whenever it is scheduled. But the thing is that if you're unable to join the class is recorded and it is uploaded on the website. You have access to that website, you have your own account, and whenever you get that much time during your job period, you can just go through that recorded session, and it just according to your feasibility. Okay. Okay, I think we are done with all of the questions. And if you have any other question, you can ask me. I am right here, and I can answer just now. I think we don't have any other question. Thank you so much, Dr. Kusha. And I hope so this session was helpful for you. So at least you get an idea that how you are going to prepare and what are the recommended study materials by the RCPCH and how you are going to plan it, and how to focus on the different topics, and specifically how to plan your like study schedule if you are just have 3 to 4 months. And also, one thing again in the last, which I emphasized enough, that don't ratify recalls. Recalls are very important, but not for the ratification. It is to identify those topics which are being repeated by the RCPCH in your exam, so that you can make a very good, very clear, very crisp concepts and of those topics, so that when they ask you in that exam, you will be able to answer that, because they do repeat the past recalls, but they twist the scenario, they twist the options. Ask your colleagues who have attempted this October exam, they will tell you that they like to twist everything. So maybe 20% are the same recalls, but for the 50% is going to be the twisted one. So this is my just one take home message, is that don't ratify recalls. Make your clear concepts clear from any book, but with the UK guidelines. Okay, just remember that with the UK guidelines, you cannot I can say, you cannot just get away without doing these guidelines. Everything is should be according to your UK guidelines. So make concept from wherever you want of the disease, but when it's about like definitive diagnosis, sign and symptoms, their investigations and the management, that is your UK guidelines. Okay. So that's all, I think. Thank you so much for all of you to join and actively participating with all of your questions. Thank you so much. Do we have to, okay, Dr. Aisha has another question. Do we have to do all the guidelines? No, you don't have to do all the guidelines. I will post in our FAB group which guidelines are the most important that you have to do. There is no other way. Then afterwards, with the passage of the time, when we will do the discussions in the group, then you will be able to know there are some other guidelines which you can also go through that. But the most one I will post in the group, and then you can go through them. You don't need to do all of those guidelines which has been given in those books. Okay. Okay, thank you so much, Dr. Aisha. Thank you so much, all of you, for so much interactive this webinar. And I hope so it will be helpful for all of you. If still you got any query, you are always welcome to post in the group. And then whoever will be available, we will be answered there. And if you want any like guidance, you can always ask us. I am always available. And we will support you and we will guide you regarding your study plan and everything. Thank you so much. And I think I will just leave you here. Good night and Allah Hafiz. Goodbye. Sweet dreams, and keep studying and be focused. Okay. Yeah. Okay, Dr. Dania. Thank you so much. We'll see you on 23rd. Allah Hafiz. Good night.